Thank you for joining us in the next of our installment of Safety is Personal. This is where we talk to leaders about their safety journey. In this season, we have been focusing on the opioid epidemic. Today, we're with Dr. Kenji Saito. He is the Global Medical Director for Owens Corning, a corporation that's focused on insulation and roofing and has been so in the U.S. here from the 1930s. Dr. Saito also serves on the faculty of Dartmouth, Penn, and Harvard, helping to train the next generation of safety and medical leaders. Thank you, sir, for joining us.
Pleasure. Thank you for having me.
You have heard about this epidemic in our nation.
Yes.
And as you've started to look at that, certainly as a medical doctor, it became something important to you. Maybe you can just talk to us a little bit about the big picture of how this became an issue that was so important to you.
As the medical director of a corporation, it's really important that we service our employees. And as their chief medical director, my job is to service and have the privilege of caring for our employees worldwide. And for that reason, we like to look at the data, see what's affecting them, what's causing morbidity, what's causing mortality, and be able to address that in a way that's systematic and guiding principles to how do we implement it at a national level, but also regionally and jurisdictionally as well. So for that reason, we had a journey that we had to go on to make our employees healthy and well.
And I know that at some point, naloxone, which is the medicine that I referred to up front here, that you make available in your workplaces, it became over-the-counter available. And maybe you could talk to us a little bit about how did that change the dynamics for you and your organization to address being ready for a potential overdose emergency?
Being over-the-counter was actually helpful for accessibility, but didn't really change it for us too much. We actually looked at this back in 2018 as we looked at our plan design. Being that we're self-insured, we're thinking, how do we best service our employees, our beneficiaries, and most importantly, the community that they live in and work in. So for that reason, we thought, what can we do to help decrease this mortality you were referencing? It was right in the sort of the height of the pandemic of opioid overdose. We knew that was going to be an issue. It was an issue not only for our employees that are currently working for us, losing loved ones, but also hiring. It was challenging for us at that point. So we need to look at the data and how do we respond to that. So luckily we had a great leader in place. It was a personal story for a lot of our executives, and a lot of them actually was able to share that story, and it became personal to a lot of folks, and the momentum was certainly there. We were able to help manage it through our health plan and look at our pharmacy benefits, and say, how do we limit initial prescriptions of opioids? And especially legitimate ones, we need to be able to control that. So we limited it to about 3-day supply before this became a regulation.
Yeah, you were way ahead of your time if you were looking at it back then. I talked to a lot of companies, and we're still trying to get our hands around this and understand how employers can lean into this and how important it is to them, but hats off to you and your team for leaning in so early. You talked about storytelling, and you talked about some of your leaders perhaps having this touch them so closely. Everyone has a personal safety story, and it's been amazing in this series to get to hear people's personal safety story. Perhaps you could share your safety story with us today.
Yes, absolutely. It's both personal, as a brother, as a son, and as a fellow human. I think it's really important to know what affects people. How does it impact not only themselves, their loved ones, but the community that they live in and serve in? And as a physician, we're not immune to that as well. We are doctors for doctors. In those cases, we see our fellow colleagues that fall ill to some of the substance abuse. It truly is a disease that we have a treatment for. A disease needs to be acknowledged and diagnosed and could be properly treated like anything else.
I really appreciate that you said it's touched you personally with people around you, like you said, as being a son, a father, somebody who is got colleagues that may be struggling with this. When you brought this to the corporation and you wanted to put a program in place to be ready for such an emergency, to have naloxone on site, to have your emergency response people trained, what were some of the obstacles? What were some of the things that got in your way that perhaps you had to get through and you can share with others as they're going down this journey?
It's absolutely the stigma. Unfortunately, like we talked earlier, it's really a challenge for a lot of folks to accept that we want a substance-free or drug-free workplace, at the same time have a recovery-friendly place as well. And we don't think that's two different things. Luckily, the philosophy and the guiding principles we at least agreed upon philosophically was that it's not two different things. It could be one and the same. It's all about how you harmonize that and be able to harmonize that in a way that is beneficial to the employees, to their families, and to their loved ones. And if you look back at the statistics, like you mentioned earlier, a lot of people have been touched by this. So for that reason, we utilize the storytelling as an opportunity. And one thing we do really well at OC is we listen to our employees. So we asked for their stories. They shared their stories. People started to open up. And it was a great opportunity to respond to that, say, how do we best help this? And it was actually employee-led. It was employee-driven that led our leadership to say, let's respond to this.
That's great. That's fantastic. And storytelling is so powerful. You called it a disease. I know that sometimes helps folks understand, especially from a medical professional, that this isn't a weakness. It isn't something about the person's character. This truly is a disease.
Yeah, it's a challenge. And if you look at substance use disorder, sometimes there's a genetic component to it, there's an environmental component, and of course there is a behavioral psychological component to it as well. So holistically looking at it, it's a challenge. And we look at it as a disease that helps us at least diagnose it. But to understand the etiology of that is even more challenging. And the challenge is we don't know as much as we want to. We can understand at the cellular level what's going on, but at the human level, it makes it even more challenging. We're truly a network of connections, and that connection sometimes can be overbearing. But when there's a need, there needs to be a way to solve that need. And the need here was, how do we save lives? And ultimately, that's what it matters, especially as a physician, but also as a medical director for our employees. As a privilege to serving them, we need to be able to save the lives.
Yeah, I love that. It is all about just saving lives. And when that emergency situation is happening, wherever it is, in your community, in your home, at your workplace, we need to be able to be prepared to save that life.
It's so important, just like the AED example, right? Cardiovascular disease is not something that people want to have. They might have it, not know it, and have an emergency. And we're very comfortable now having AEDs in every shopping mall, every workplace, and provide that when needed in an emergency situation. We train our emergency response team. Most of them are not medical professionals, and they're able to use it and revive a life and save a life.
Yeah.
And I think we should look at it in the same way here.
Naloxone with every AED.
Exactly.
Yeah. And talk a little bit about, I know a lot of folks have a lot of questions still about naloxone or Narcan, whatever the drug might be called, about whether or not it's hard to use, or whether or not, if you aren't a trained person, can you hurt someone if they're not overdosing? Any kind of context you can provide us regarding this?
Yeah. So the data supports it now that it is a safe way to deliver it. Non-medical professionals can deliver it. Just like AEDs, they had the same concern. If we just leave it in the mall, can anybody use it? And luckily with advancements in technology, it's becoming easier, more user-friendly, and it's definitely something that's very trainable in a very safe environment, in a way that people feel comfortable using it and administrating it in a very safe way for children to adults.
Yeah, that's fantastic. It's almost you say it's too good to be true. You really can save a life and you can't hurt someone.
Exactly.
And it's very easy to use if you follow the directions. So
Exactly.
I just want to say thank you, first and foremost, for everything you do in your medical profession, but specifically for helping your workplace, understand that this is something that can be leaned into, and that we can be ready for that emergency to make sure that person goes home at night to their family or whatever care that they might need. I am sure you are saving lives, and by sharing your story here today, you're going to save even more.
Well, thank you, but I can't take all the credit for that. It takes a team to do this. So I'd like to thank our leadership back at Owens Corning, but also our medical team that services a lot of the employees that we have around the world.
Dr. Saito, thank you so much for joining us here today.
Pleasure.
And sharing your story, not only personally, but that of your corporation. With that, you will be saving lives, and with everybody who gets to see this, we'll be able to change perspectives and behavior. So thank you so much. And thank you all for joining us for this series of Our Safety is Personal, and I look forward to seeing you next time. Thank you for joining this conversation. To watch all of our episodes on demand, go to safetyispersonal.org.